Suppose a patient is a diseased, okay, and you have diagnosed the disease. Now you are treating the patient, and after 1 or 2 weeks you want to know the status, okay. So whether the patient is improving or not, you can assess with the help of ESR. If the ESR value is coming towards normal, that means decreasing. In disease state, it increases. If it is decreasing, that means that's a good sign. Patient is improving. But if it is not improving, that's indicate that maybe the patient is not getting a proper treatment, okay, or he is not responding to the treatment. Is it clear? Okay. So this was the prognostic importance of the ESR. What's your name? Yes. Okay, you tell me what is the other use of ESR to diagnose any disease? No, it's a very non-specific test. It gets raised in many kinds of diseases. So it's not a very specific test. One utility is prognosis, which I discussed right now. Other use, you know or you don't know? Okay, sit down. Can you please tell me other use of ESR? You don't know, sit down. You? Can you tell me? Anyone? Nobody knows that? Only one use. There must be some other use also. The other use is to suppose I am giving you a condition, a patient is a diseased, okay? He is complaining of the signs and symptoms regarding a particular disease, but you are not able to get some positive results. Okay, patient is complaining of signs and symptoms regarding malaria-like symptoms, or symptoms like non-specific, he is having fever or having anorexia or some other symptoms. But when you are going to do the test, you are getting the negative results. So how can you confirm? Yes, come in. How can you confirm that whether this is he is a diseased or he is just a psychiatric patient? Are you getting my point? You want to know whether this patient is complaining, is he really diseased or he is just having psychiatric symptoms, or he is just joking to you. He is just saying this and that, not he is diseased. How can you know? In that case, the role of ESR comes to rule out any hidden or occult disease. If you do this test and you get the result that ESR value is raised, that means he is really a diseased person, okay. Then you will go for a big panel of tests and you will try to find out the reason. So is it clear? Okay. So now moving to the today's class. Today's class is on the peripheral blood smear. So how many of you have made the peripheral blood smear of your own, by your own hands? Peripheral blood smear, how many of you? Not from slide, from the blood sample, start from the blood sample. From where did you get the blood sample? Your own blood you used, okay, fine. So you done a prick on your finger and you get the one drop of blood. Okay, now start. First you drop the blood on a glass slide. Okay, now? Using another glass slide. Okay, another glass slide you are using? Okay, how? What is the name of the other glass slide? Don't know. Okay, sit down. You made that? Okay, tell me how you made the PBS. Okay, that part has been done. You have dropped one drop of blood on a glass slide. Now start.
Then okay, another slide.
Another slide. What's the name of another slide? You have to know. Okay. The other, anyone else? Do they know what is the name of that other slide which is used for preparing the PBS? Spreader. Spreader. Okay. Okay, now start. Then the other slide which is a spreader, you put it where? Front of the blood. Okay, blood drop. Then moved back. Okay. First you touched it with that blood drop. Okay. Is it right? With the spreader, you first put it on the glass slide just in front of the blood drop. Then you go back and try to touch the blood drop. Okay. Just after touching, the blood drop gets spread. Okay. Then what you are going to do now? Before that, what will be the angle? There must be some angle. What is the angle? Normal angle that should be? Yes, very good. It should be 30 to 45. Ideally, it is, sit down. It should be 30 degree, but 45 degree is also okay. Then with a uniform speed, you have to spread up to the end of the slide. Okay. So this is the ideal way of making a peripheral blood smear. Now after making the peripheral blood smear, what you are going to do? Please tell me. Yes. After you have prepared a peripheral blood smear. Okay, very good. Air dry. Then after that, what will you do? Yes. Before staining, what will you do? You have air dried and you are going to stain the slide. Before that, what is very important step? Don't know. Okay. Can you tell me? Anyone? Very important step is of making an identity on the slide. Writing your name or giving any identity, because that is important. If you are going to report a patient, you are using a patient blood sample and you are going to report based on that slide, identity is very important. Otherwise, you will make a major mistake. So, next step, can you continue? You have made an ID on that slide. Okay. Maybe you can write the patient name in short or your name. Okay. Now, how will you stain? By which drop? Stain. Okay, very good. Which stain you are going to use? Leishman stain. Very good. What is the content of Leishman stain? Can you tell me? Okay. Okay. That what you told me, that we can collectively call it Leishman powder, which contains both these two stains. Okay. That is the Leishman dye or Leishman powder, you can say. Now, that stain which you are using, that is in the liquid form. That means the Leishman powder must be dissolved in some fluid. So what is that name of that fluid? Anyone? Nobody knows that? No, it is not distilled water. It is 100% wrong. Distilled water is 100% wrong. Yes? From this side, anyone can try? Sit down. The Leishman powder is dissolved in acetone-free absolute methyl alcohol. Is it clear? What is the solvent? It should be free from acetone and also free from water. It should be absolute methyl alcohol. Okay. So you have dropped, who was saying about the staining? You were saying, no? You were saying. Okay. So now tell me, first of all, you dropped the stain solution on the slide and covered the slide. Okay. Now, what are you going to do now? Yes. Wait for 2 minutes. Okay, fine. Very good. Then you will put the distilled water. Okay, fine. Then how much long you will wait? 10 minutes. Very good. Then after 10 minutes? Okay, you will wash the excess stain. Fine. Very good. Then dry and look under the microscope. Okay. The procedure is absolutely correct. Now, you tell me, yes, why are you okay with her procedure? Okay. So you tell me, why did she told that after giving the staining solution, waiting for 2 minutes? Okay. And when the staining process is going on then? First 2 minutes is for fixation. That's absolutely correct. That is for fixation. Then staining is going on when? After the addition of distilled water. Okay. And which thing is doing the fixation? Which one is actually doing the fixation? In the Leishman solution, the presence of methyl alcohol, which is absolute methyl alcohol, that is actually doing the fixation, and the 2 minutes period is for the fixation. And after addition of the water or the distilled water, the actual process of staining starts. Okay, is it clear now? Okay. So now we are going to discuss the peripheral blood smear finding in a microcytic hypochromic anemia. Okay. This is the thing which I already discussed, how to make a good smear, and an ideal smear should be of tongue shaped. Okay. Do you notice what is the difference between this spreader and this glass slide? Which you have used, that was not ideal. This is an ideal spreader. Okay. What is the difference between these two? The corners are, means it has been broken or modified. Actually, edge should be shorter than actual slide. Okay, main thing is that its edge, the edge which is going to contact with this blood, that should be shorter than this slide. Why? Because if edge will be shorter, then this end will not come here. Is it right? This edge will come here, not here or here. So that if you want to find anything on the edge, you want to see on the microscope, then you will be able to see. But if it is here, you will not be able to focus properly. Okay. So can anyone tell me what kind of thing we usually observe on the edges? We generally observe on the edges. Most of the time we observe the blood cells, RBCs, WBCs, platelets, etc. on this part. Okay. What is the thing which we generally observe on the edge? And for this kind of spreader is used. Anybody knows that? Malaria parasite. Okay. The malaria parasite generally seen on the edges. So if we are going to find in a patient, the malaria parasite, we have to look for the edges. Okay. So now this is a photomicrograph of a microcytic hypochromic anemia. Before that, tell me what are the reasons of microcytic hypochromic anemia. Before that, I want to know whether you know what is microcytic and hypochromic. Hello, can you tell me what is microcytic? Yes, small in shape of which? Whose shape is small? RBC. Okay, very good. How will you compare it? Normal RBC. In a patient having microcytic anemia, all the RBCs will be of a smaller size. So, how will you compare with other cells? Which cell? You don't know. Can you tell me? No. Wrong. Any other cell? Can you? Don't know. Anyone? How an RBC is compared, whether it's large in size or small in size? It is compared with nucleus of an small lymphocyte. Okay? Can you tell me how an RBC is compared? Yes? Just now I told. Are you not listening to the class?
Type of small lymphocyte.
Yes?
Another small lymphocyte.
Which part of a small lymphocyte? Yes, by the help of nucleus. Sit down. Nucleus of a small lymphocyte, you are going to compare the RBCs. If the RBCs are larger than that, what will you call it? Macrocytic. If it is smaller than that, microcytic. And if it is equal to it, then normocytic. Okay. So, the one term has been cleared now. Microcytic has been cleared. You will be able to identify that. Okay, very good. Now tell me, what is hypochromasia? You tell me. Paler in color. Okay. Means hemoglobin concentration is less as compared to a normal RBC. Very good. How will you know it? So, how will you know? Means you are saying that you will compare it by other RBCs. All the RBCs are hypochromic. Then what will you do? There must be something by which you can compare, just like the size. For hypochromasia, how will you compare? Okay, sir. Can you? Anyone? Yes? MCHC, that is a different thing. We are discussing here the peripheral blood smear finding. MCHC is, you are not wrong, but in PBS, how will you compare? What is central pallor? Can anyone tell me? Central pallor on the RBCs? Central pallor? What is the normal shape of an RBC? Can you tell me? Normal shape of an RBC? Biconcave. Okay, very good. So, because of its shape, the center portion, when it is looked from the microscope, it looks paler. In a normal RBC, I am saying. Okay. So, there is a central pallor zone, which is called a central pallor. Okay. So, this region should be less than 1/3 of the diameter of an RBC. Is it clear to all? What it should be? Less than 1/3 of the diameter of an RBC. Okay. If it is more than that, then we will call hypochromic RBCs. Is it clear now? Clear to all? So, now you will be able to identify microcytic hypochromic RBCs. Okay. Now tell me, what are the reasons of microcytic hypochromic RBCs or anemia? Anyone? Iron deficiency anemia, very good. Thalassemia, okay. You have to tell Full name, beta thalassemia trait you have to tell. Okay. Beta thalassemia trait leads to microcytic hypochromic RBCs or microcytic hypochromic anemia. Any other causes of this? One is iron deficiency anemia, another one is beta thalassemia trait. Any other causes? Anemia of chronic disease. Third reason is anemia of chronic disease. Okay. The fourth reason is sideroblastic anemia. These are 4 causes of microcytic hypochromic anemia. Okay. Clear? So, this is a peripheral blood picture showing microcytic hypochromic RBCs. Is it clear to all or anyone having some doubt in this picture? Can you describe the RBCs? Yes? Just try to describe these RBCs. How can you say it is small? Actually, there is no nucleus here. So, you can't say here is small. Okay. If you are looking at the PBS, then you have to find first a small lymphocyte. Then you can compare. But what other thing which can you tell here? Yes, very good. The central pallor is actually too much increased. So, you can say it to be hypochromic. And remember that if the RBCs are hypochromic, they will definitely be smaller in size. Okay. So, hypochromic RBCs are present. Now, what can you see here? This is slide from a patient having beta thalassemia trait. Okay. What can you see here? Central pallor, can you see? Central pallor increased, though here is no lymphocyte present, but still you can see that the central pallor is more than 1/3 of the RBC size. Okay. What is this? What is this? Can anyone identify it? This one. কেউ বলতে পারবে? This is actually basophilic stippling. Okay, this is the defect seen in RBCs in case of beta thalassemia trait. Can also be seen in lead poisoning. Okay, have you heard about lead poisoning? Basophilic stippling is very characteristically present in that case. Okay, but it can be also be seen in many other disorders. One of them is beta thalassemia trait. Okay. Clear? Now, hello, you please describe the RBCs here. Here is a lymphocyte present. Can you see the lymphocyte, small lymphocyte? Now, you tell me what you can see here. Okay, very good. So, these are microcytic RBCs. Hypochromic, are they? Yes, they are hypochromic because the central pallor in most of the cells are too much raised. Okay. Any other thing can you find here? Any other finding, characteristic finding? See the size of these RBCs and see the size of these RBCs. Any difference can you see here? Different sized RBCs are present. What the terminology is called? Anisocytosis. Okay. If different sized RBCs are present in a peripheral blood smear, we call it anisocytosis. And if different shaped RBCs are present, means one RBC is round, one is ellipsoid, one is some other shape, we call it poikilocytosis. And if both are present, anisopoikilocytosis. Okay, clear? So, anisocytosis is characteristically seen in iron deficiency anemia. Okay, and in beta thalassemia trait, the RBCs are more or less of uniform shape. Okay. Is it clear? I can show you the RBCs present here in beta thalassemia trait. Okay. You can see the RBCs, maybe they are microcytic and hypochromic, but they are not varying in size. Okay. While in case of iron deficiency anemia, the sizes of RBCs are too much differing. Okay. Clear? So, can anyone in this class tell me the RBC indices which is actually used to indicate the size variation? RBC indices which indicates the size variation of the RBCs. Yes? MCV, that indicates the size of an RBC, average size of RBC. It does not indicate the variation in the size. Any other? Anyone can try? Are you getting my question? The indices which indicate the size variation. Nobody knows that? RDW, red cell distribution width. RDW, in short it is called as. Okay. If it is raised, it indicates that there is more variations of RBCs. Okay. And if it is within normal limit, then that indicates most of the RBCs is of uniform shapes and sizes. Okay. So, now you please stand up and describe the RBCs present here. Okay, size is different. Are they microcytic or macrocytic? What about the size? Micro, okay, fine. And hypochromic or hyperchromic? Hypo. How can you say that? Pallor, where is the pallor? It seems to be hyperchromic. Where is the central pallor? Where that has gone? Size of the RBCs are okay. It has decreased. But what about the central pallor? So, what are these things? Yes? We never use this term hyperchromic because these things are something else. These are not the microcytic or hyperchromic RBCs. This kind of term does not exist. So, can anyone, okay, sit down. Anyone guess what are these cells? These cells who have lost their central pallor. Anyone can guess? Yes? No. These are not malaria parasites. Anyone can guess? Till now we were learning that microcytic RBC is hypochromic. The central pallor is a normal finding. Here the central pallor has been lost. What is going on here? Anyone can guess? What are these? These are actually spherocytes. You have heard about the spherocytes? Anyone have heard about the spherocytes? Nobody? Okay. Actually, the spherocytes, there are many other conditions. Some are hereditary, some are acquired conditions, in which the RBC shape gets changed. Normal shape, he told me, biconcave, but it gets biconvex. Okay, it gets biconvex. Because of that change in the shape, the RBC loses the central pallor. Okay, So these are the spherocytes. Is it clear now? Now moving on to the next slide. Can you describe the RBCs here? Yes? Describe, stand up and describe. What are the, how will you describe these RBCs? Microcytic, okay. Hypochromic or normochromic? Normochromic, okay, very good. Because most of the RBCs here, they have not lost their central pallor, okay, and the central pallor is normal. It is not more than 1/3. So these are normal RBCs. Maybe the size is small. You can say here microcytic normochromic, you can say. Can you tell me that which cell is it? This cell. No, it's not lymphocyte. Any other guesses? Okay, sit down. Can you tell me which cell is this? Yes? Monocyte? No. First of all, you should know what is the size variation of the WBCs. Monocyte is the largest cell in the peripheral blood smear. Can you see here the size of this cell? Just equal to an RBC. It can't be a monocyte. Try other. Okay, sit down. Can anyone try from this side? Which cell is this one? Macrophage, no. Macrophage is very large cell and it generally doesn't comes in the peripheral blood smear. Anyone else can guess this cell? No one? Okay. Now, can you tell me the description of a neutrophil? Yes? Okay. Thank you. Describe a neutrophil. First, start from the size, shape, cytoplasm, granules, then comes the nucleus. Yes? Round in shape, okay, fine. Size? Mone nahi. Okay. Generally, for understanding purpose, it is considered to be double the size of an RBC. Okay. Its size is about double. Exactly it is 12 to 15 micron. Exactly. But it is considered to be double the size of an RBC. Okay. Continue then. Cytoplasm granulated or agranulated? Granulated, very good. Which kind of granules? Don't know. Fine or coarse? Okay, sit down. Can you proceed further? Coarse? No. Try some other thing. It must be fine granule then. If coarse granule is the wrong answer, then must be fine granules. Okay. Then? Yes? 2 is wrong answer. More than 3 is right. At least 3, not nucleus, lobes. The nucleus is 1. Okay. The 3 lobes are there. Sit down. So, description of a neutrophil, is it clear to all? Can you describe the eosinophil? Yes?
So, eosinophil is round in shape.
Round in shape, very good.
It is almost the size of an RBC.
No, 100% wrong. Monocyte, you are describing? Eosinophil. No, not size of an RBC. It is double the size of an RBC. Actual dimension 12 to 16 micron. Okay. Now continue.
Granules are present.
Which kind of granules? Fine or coarse? Coarse granules. Okay. Color of the granules?
Sir, blue.
No. Eosinophil.
Sir, brick red.
Brick red colored. Yes. Brick red colored granules are there in the eosinophils. Nucleus?
It is a bilobe shape.
Yes, very good. It's a bilobe nucleus. Okay. Description, sit down. Description of neutrophil, eosinophil clear to all? Okay. So, can you describe a monocyte?
So, monocyte is
Shape, from shape. Yes, round shape. Size?
larger than RBC.
Just by saying is not enough. You have to say how many times larger than RBCs. 2 times, 3 times, or equal to an RBC, or just slightly larger than RBC. You have to say that. At least 3 times. It is the largest cell in the peripheral blood smear. 3 times the size of an RBC. Okay, continue. Cytoplasm? Granulated. Okay, very good. Then color. If the granules are not present, then you have to describe the cytoplasm. Grayish blue. Okay. Then nucleus. Lobated or non-lobated? Non-lobated. Okay, very good. But indented. Kidney shaped most of the time it is told. But okay, sit down. But it is actually indentation is there. Okay. I think lymphocyte description is very clear. Is it necessary to describe the lymphocyte? It is very clear cut, anyone can identify. So, can this cell fit any of those description? Whether lymphocyte, neutrophil, or monocyte, or eosinophil, then which cell is it? No. Basophil contains which kind of granules? Is it granulated or agranulated? It contains coarse purple colored granules. It's actually a nucleated RBC. Okay. It's a nucleated RBC. Okay, fine. So, actually this neutrophilia, why I discussed the neutrophil description, because in the previous week it was vacation, the classes were not, it was off. So, this topic was not covered. Okay. This topic was not covered, and probably you will not get the chance to get this topic. So, that is why I thought that this should be discussed in today's class. Okay. So, I am briefly going through it. So, neutrophil description, is it clear? Okay. So, these are the neutrophils. I am not going into detail. This is the normal count of a neutrophil, 2000 to 7000, absolute count I am talking about. If you go for the percentage, it is 40 to 80%. Okay. If it is less than that, more than 7500, we call it neutrophilia. Okay. Fine. Causes of neutrophilia, anyone? 2 to 3 causes? Any kind of bacterial infection, very good. Any kind of inflammation. Also, it can due to necrosis like acute myocardial infarction, and there are some physiological causes of yes. Yes, very good. Stress during pregnancy, during exercise, it can get raised. So, there are, I am not going into detail of this. This will be not be required. Now, in the neutrophil, there is something called hypersegmented neutrophils. Okay. So, what is the lobation of a normal neutrophil? 3 to 5. Okay. If the number of lobes are more than 5, that means 6 lobes or 7 lobes are there, then we call it a hypersegmented neutrophil. Okay. Why is it important? Because anyone tell me in which condition hypersegmented neutrophils are seen? Due to vitamin B12 deficiency anemia. Okay, in that condition hypersegmented neutrophils are seen. Okay. Similarly, if we are saying hypersegmented, there is something called hyposegmented neutrophils also. Okay. If the number of lobes are less than 3, that means 2 lobes, we call it hyposegmented neutrophils. These are found in which conditions? In myelodysplastic syndrome or also in acute leukemias. We see hyposegmented neutrophils. Okay, clear? Now coming to eosinophilia. Eosinophil description is clear to all? This is a eosinophil. Remember, the size almost double the RBCs. Cytoplasm containing coarse granules, brick red colored granules, and nucleus is bilobed. All of you will be able to identify in the exam. Okay. And which cell is this one? Very faint but is still visible. Can anyone try this? Which cell is this one? Try to identify. বোঝা যাচ্ছে না? Neutrophil. It's a neutrophil. এটাকে দেখো কিছু ওইদিকে ইউসিনোফিল, এইদিকে নিউট্রোফিল। বুঝতে পেরেছো? ওইদিকে তুমি দেখে নিয়েছো ইউসিনোফিলটা, বুঝতে পেরেছো? গ্র্যানুল শুধু না, ওই কোর্স গ্র্যানুল, তার সঙ্গে ব্রিক রেড কালার, আর নিউক্লিয়াসটা বাইলোবড। এই তিনটে জিনিসটা বুঝতে হবে, ঠিক আছে? বোঝা যাচ্ছে? কি সেল বুঝতে পেরেছো? এখানে কি কি দেখতে পেরেছো?
ওই 10 o'clock এর দিকে,
না ওইটা না, এটাতে বলছি। হ্যাঁ,
10 o'clock এর দিকে হরসুসের স্ট্রাকচার, আর আরবিসি,
আরবিসি তো আছে। হ্যাঁ,
আর নিউট্রোফিল।
নিউট্রোফিল মেনলি এখানে নিউট্রোফিলটাই আছে, আর ইওসিনোফিলটা ওইদিকে রেখেছি। কত? 7 o'clock না, এখানে যত সেল আছে সবকটাই কিন্তু নিউট্রোফিল না। ওটা যেটা তুমি 7 o'clock এর দিকে যেটা বলছো, ওটা সাইজটা দেখো, ওটা মানে ডিজেনারেটেড একটা সেল, জাস্ট একটা গোল মতো নিউক্লিয়াস আছে। তো দেখো, ওটা তোমাকে দেখতে হবে সেলের শুধু নিউক্লিয়াস আছে নাকি ওর সাইটোপ্লাজমও আছে। ঠিক আছে, ওর যদি সাইটোপ্লাজম না থাকে, দ্যাট মিনস দ্যাট ইজ আ ডিজেনারেটেড সেল অ্যান্ড ইউ হ্যাভ টু নট মেক এনি কমেন্ট অন দ্যাট সেল। ঠিক আছে, যে সেলটা নর্মাল আছে বা ভায়াবেল, ওর উপর তুমি কমেন্টটা দেবে। আচ্ছা, দেখছি কোনটাকে বলছো। অ্যাকচুয়ালি কিছুটা সময় কি হয়, যেটা তুমি বলছো আইডিয়ালি ব্যান্ড ফর্ম যেটাকে বলে না, ব্যান্ড ফর্ম শুনেছো? শোনি, আচ্ছা। নিউট্রোফিল যখন ম্যাচিওর করে ব্লাস্ট থেকে, তখন অনেকটা স্টেজেস থাকে। এই আমি যেটা বলছি সেটা ভালো করে তোমরাও শোনো, ঠিক আছে? যারা দেখছো সেটা দেখো। যখন একটা ব্যান্ড ফর্ম মানে নিউট্রোফিল আসে কোথায় থেকে? ব্লাস্ট থেকে আসে, জানো তো এটা? ব্লাস্ট থেকে আসে, সেটা কোথায় থাকে? বোন ম্যারোতে থাকে, ঠিক আছে? তো এই যে ম্যাচুরেশন হয়, সেটাতে একটা স্টেজে আসে যেটা ব্লাস্ট হয়ে যায় প্রোমাইলোসাইট, ঠিক আছে? ব্লাস্ট হয়ে যায় প্রোমাইলোসাইট, তারপর ওটা ম্যাচিওর হয় মাইলোসাইট হয়ে যায়, ঠিক আছে? তারপরে স্টেজটা হচ্ছে মেটামাইলোসাইট, তারপরে হচ্ছে ব্যান্ড ফর্ম, তারপরে ওটা হয়ে যাবে নিউট্রোফিল, ঠিক আছে? তাহলে কি কি স্টেপটা হলো? ব্লাস্ট আছে, তারপর প্রোমাইলোসাইট, মাইলোসাইট, মেটামাইলোসাইট, ব্যান্ড ফর্ম, হর্সশু শেপের যেটা আইডিয়ালি ব্যান্ড ফর্মে থাকে। আর মেটামাইলোসাইটে নিউক্লিয়াসটা ইনডেন্টেড থাকে, ঠিক আছে? এবার সবকটাও তোমাদের লাগবে না, কিন্তু এটা জেনে রাখতে হবে, ঠিক আছে? কিন্তু যেটা তুমি বলছো আমি লক্ষ্য করেছি, ওটা কিন্তু অ্যাকচুয়ালি একটা নিউট্রোফিলি। ওটা মানে হ্যাঁ, মানে থার্ড লোবটা একটু পিছন দিকে চলে গেছে, ঠিক আছে? সেই জন্য বোঝা যাচ্ছে না। আচ্ছা, নিউট্রোফিলের নর্মাল পার্সেন্টেজ কত? 40 to 80, ওকে। আর ইওসিনোফিল? এটা কিন্তু ওখানে ছিল না, ওই জন্য জিজ্ঞেস করেছি। কত? অ্যাবসলিউটলি রং। 20% to 40% এটা লিম্ফোসাইটের, নট অফ ইওসিনোফিল।
8 to 10%.
8 to 10 is not correct actually. 1 to 6%, ঠিক আছে? 1 to 6%। 8 to 10% এটা একটু বর্ডার লাইনে চলে যায়, আর 10% এর বেশি হলে কিন্তু ইওসিনোফিলিয়া বলে দেওয়া হয়। অ্যাকচুয়াল কাট অফ হচ্ছে 500 অ্যাবসলিউট কাউন্ট, ঠিক আছে? যখন অ্যাবসলিউট ইওসিনোফিল কাউন্ট 500 এর বেশি হয়ে গেলে আমরা ইওসিনোফিল বলে দিই, ইওসিনোফিলিয়া বলে দিই। সবারই দেখা হয়ে গেছে? আচ্ছা, আরেকটা স্লাইড আছে, ওটা আমি এবার ফোকাস করব। আচ্ছা, তোমরা সবাই মাইক্রোসাইটিক আর ম্যাক্রোসাইটিক ভালো করে চিনতে পারবে তো? চিনতে পারবে তো এবার? মাইক্রোসাইটিক, ম্যাক্রোসাইটিক, নর্মোক্রমিক, হাইপোক্রমিক চিনতে পারবে তো? পরীক্ষার সময় এটা কিন্তু বেসিক। আচ্ছা, এখানে তাহলে তোমরা আরবিসিটাকে বলবে যে এটা কি আছে, নর্মো না ম্যাক্রো না মাইক্রো, কি আছে? সবাই দেখে একজন করে বলো কার কি ইমপ্রেশন, এক একজন করে দেখো। মানে লিম্ফোসাইটের রেফারেন্সটা না থাকে মানে কি রকম?
স্লাইডে যদি না থাকে লিম্ফোসাইট, তাহলে
স্লাইডে এমনি এটা কিন্তু খুবই রেয়ার তুমি যেটা বলছো, ঠিক আছে? মানে খুবই রেয়ারেস্ট অফ দ্য রেয়ার কন্ডিশন যেটাতে লিম্ফোসাইট থাকবে না। সেটা হতে পারে যেমন তোমার লিউকেমিয়াতে যে কি হয়, যে অ্যাকিউট লিউকেমিয়া বিশেষ করে, সেটাতে একবারেই কোনো সেলই থাকে না, না নিউট্রোফিলি থাকে, না ইওসিনোফিলি থাকে, না লিম্ফোসাইটই থাকে, একদম মানে শুধু ব্লাস্ট পাওয়া যায়। তো ওই রকম কন্ডিশনে জেনারেলি মানে আরবিসিটা মানে আমরা একটা অন অ্যান অ্যাভারেজ দেখি, ঠিক আছে? মানে কিরকম দেখা যাচ্ছে, আর উই রিলাই অন দ্য এমসিভি এমসিএইচ এর ভ্যালুস, ওকে? আর ওই সব কন্ডিশনে এমনি যেটা ডাব্লিউবিসিতে যে অ্যাবনর্মালিটি, ওটা মোস্ট ইম্পর্টেন্ট হয়ে যায় আমাদের জন্য, ঠিক আছে? তুমি দেখেছো কি লেগেছে তোমার? নর্মাল লেগেছে, ঠিক আছে। তোমার কি মনে হচ্ছে? মাইক্রোসাইটিক, আচ্ছা। ক্রোমাশিয়া ব্যাপারে নর্মাল, আচ্ছা, মানে মাইক্রোসাইটিক নর্মোক্রমিক এটা বলতে চাইছো। কি মনে হলো তোমার? মাইক্রোসাইটিক নর্মোক্রমিক নিজে থেকে বলছো নাকি ওদেরকে শুনে বলছো? কি মনে হচ্ছে তোমার? মাইক্রো না ম্যাক্রো? মাইক্রো, আচ্ছা। প্রিডমিনেন্টলি বলছো তো, মানে বেশিরভাগ আরবিসিস গুলো? মাঝখানে সেন্টারে ফোকাস করে রেখেছি তো, কেউ নড়িয়ে দিয়েছে? মাঝখানে আমি ফোকাস করেছিলাম লিম্ফোসাইটটা। ওটা হয়ে যাক, তারপরে দেখছি ওটাকে তাহলে সেন্টারে করে দেবো। লিম্ফোসাইটটা মাঝখানেই আছে তো? হ্যাঁ মাঝখানেই আছে তো। তুমি আরেকবার দেখতে চাও? দেখো, দেখে আবার ইমপ্রেশনটা বলো। নর্মোসাইটিক আছে। কি মনে হচ্ছে তোমার? নর্মোসাইটিক নর্মোক্রমিক, ঠিক আছে। অন্য একজন দেখো। আচ্ছা, এমসিভি নর্মাল ভ্যালুটা কি?
78 to 94.
ওকে, ঠিক আছে। আর এমসিএইচ এর? ওকে, পাইকোগ্রাম, ওকে। তোমার কি আছে ইমপ্রেশন?
নর্মোসাইটিক কিন্তু ক্রমিক মানে যেটা বুঝতে পারছি।
আচ্ছা, ওটা বুঝতে পারছো না। নর্মোসাইটিক, ওকে। তো ঠিক আছে, মানে কিছু জন আছে যাদেরকে মাইক্রোসাইটিক লেগেছে, মানে সাইজটা ছোট, বাট ক্রোমাশিয়াটা সবারই মানে নর্মোসাইটিক, নর্মোক্রমিক ছিল, নর্মোক্রমিক। তো অ্যাকচুয়ালি এর এমসিভি ছিল 104, ঠিক আছে। আর এমসিএইচ ওয়াজ 34। তো এবার বলো কি হওয়া উচিত? ম্যাক্রোসাইটিক, একটু ম্যাক্রোসাইটিক, বাট যখন 110-এর বেশি হয় তখন মানে ভালোভাবে বোঝা যায় যে বড় সাইজের আছে, ম্যাক্রোসাইটিক আছে, ঠিক আছে। এমনি 104 থাকলে মানে জাস্ট একটু বেশি আছে, তখন অতটা বোঝা যায় না। এমনি যদি লক্ষ্য করে দেখো, কিছুটা আরবিসি আছে যেটা বড় সাইজের। আমি লিম্ফোসাইটের নিউক্লিয়াসটা বলেছি, নট দ্য সাইজ অফ এ লিম্ফোসাইট, ঠিক আছে। লিম্ফোসাইটের নিউক্লিয়াসটা যদি দেখো এবার, তাহলে আবার দেখবে এটা কিছুটা আরবিসি আছে যেটা ওর থেকে বড় সাইজের আছে, ঠিক আছে। আর ক্রোমাশিয়া তো নর্মাল আছে, ঠিক আছে। এবার তাহলে তোমরা বুঝতে পেরেছো মাইক্রোসাইটিক কোনোভাবে বলা যাবে না, ঠিক আছে। আর যদি কিছু আরবিসি একটু ছোট সাইজের লাগে, তো প্রিডমিনেন্টলি আরবিসি পপুলেশনটা কি আছে সেটা বলতে হবে, ঠিক আছে। একটা ছোট থাকলে আমি মাইক্রোসাইটিক বলে দেবো, সেটা হবে না, ঠিক আছে। তাহলে ওটা দেখলে ভুল হয়ে যাবে, ঠিক আছে, মানে ধরো যে 100টা আরবিসি দেখতে পাচ্ছ, ওটার মধ্যে যদি একটা দুটো ছোট থাকে ওটাকে বাদ দিয়ে দিতে হবে। 90s আরবিসি আর কিরকম, 95 আরবিসি আর কিরকম, বা 80% অফ আরবিসি আর কিরকম, এটা দেখতে হবে। ঠিক আছে, বুঝতে পেরেছো? এবার ভালো করে দেখো এবার।